They mocked the quiet new nurse until the Navy came for their SEAL combat medic. The woman everyone ignored was the only one who could save the man no one was supposed to know about. The call came at 11:47 p.m. Not to the charge nurse, not to the attending physician, not to anyone at the front desk. It came through the hospital's internal line, routed twice before it landed at the nurse's station on the third floor of Mercy General, and when the desk phone rang, only one person picked it up. She had been standing at the medication cart, counting vials of potassium chloride, her pen moving slowly down the checklist. She picked up the phone with her left hand without stopping the count. The voice on the other end said one word that was not a medical term, not a code, not a patient number, just a word that made her hands stop moving and her eyes go to the door at the end of the hall. She set the phone down without saying anything back. She finished the count. Then she walked toward that door, and everything that came after was something no one in that hospital was prepared to see. Her name tag said CLAIRE. It was slightly crooked. It had been slightly crooked for 3 weeks since she started at Mercy General, and not one person on the floor had mentioned it. The same way no one had mentioned that she always took the stairs, or that she never put her back to a window, or that when she walked through the ICU she did not look at the monitors first the way new nurses always did. She looked at the patients. She looked at faces before numbers. The third floor supervisor was a woman named Linda Brecht who had 22 years at Mercy General, and a way of explaining the hospital's hierarchy that always ended with the same sentence: everyone finds their place eventually. She said this to Claire on her first day while showing her where the supply closet was. Claire had nodded and said thank you, and Linda had moved on to the next item on the orientation list, satisfied in the way people are satisfied when they believe a thing has been established. The other nurses were not unkind. They were busy, they were tired, they were people doing a hard job in a hospital that was always 3 nurses short and 2 beds over capacity, and a new face on the floor meant one more person to catch up instead of one less task to carry. Claire did not require catching up. She found her patients, read their charts, and was at the bedside before any of them expected her. This did not read as competence to the people around her. It read as luck. She was quiet and she showed up on time, and she did not make mistakes in the visible ways that get noticed. So the only feedback she received in 3 weeks came from Linda, who stopped her once near the end of a shift and said she needed to smile more at the family members in the waiting room. Claire said she would work on that. There was one moment in her first week that had not been forgot, though no one spoke about it directly. A second-year resident named Torres had been placing a central line, and something had gone slightly wrong, the catheter threading in a direction it should not have gone, and he had been talking through the process to the nursing student beside him when Claire had appeared at the curtain. She had not come in. She had just stood at the edge of the curtain and looked at the placement angle of his hand and said one sentence. She said, "His subclavian is higher than it looks on the image." Torres had stopped. He had looked at her. She had already turned to go back to her medication cart. He had adjusted the angle. The line had threaded perfectly. He had not said anything to Claire after the procedure. He had told the nursing student later that he had caught the error himself, which the nursing student had not corrected because she was not in a position to correct a resident, and that was just how the building worked. Claire had heard none of this. She was at her medication cart counting. The floor was fluorescent and humming. The smell of the third floor at night was always the same, a specific combination of floor cleaner and recycled air, and something underneath both of those things that was harder to name. It was the smell of bodies working hard to stay alive. Claire had worked in enough rooms that smelled this way that she no longer registered it consciously. It registered in a different part of her, the part that was always running a quiet background process, listening for sounds that did not belong. The sound that night at 11:51 p.m. was footsteps in the stairwell that were wrong. Not wrong because they were fast, wrong because they were controlled. Whoever was coming up those stairs was moving quickly but evenly. No slap of foot against concrete. No variation in rhythm, the rhythm of someone trained to move under weight in a hurry without making the kind of noise that gets people killed. Claire was at the nurse's station when she heard it. She picked up her bag from under the desk. The bag that none of her colleagues had ever asked about, the one that was heavier than a nurse's bag had any reason to be, the one she kept hooked on the same hook every shift without ever setting it in the supply room the way the others stored their things. She had it on her shoulder when the stairwell door opened. 2 men came through, civilian clothes, both moving with the same controlled rhythm she had heard on the stairs. The taller one had a cut above his eyebrow that had been field dressed with steri strips applied at an angle that told her the person who applied them had done it without a mirror, or without light, or both. The shorter one had his hand pressed to his ribs with a steadiness that meant the pain had been there long enough that he had learned to carry it without changing his expression. They were not looking at the nurse's station, they were looking at the room numbers. The taller one saw her first. He stopped. She said nothing. She looked at the hand pressed to the ribs, and she looked at the field-dressed cut, and she looked at the way both of them were standing, weight slightly forward, close to the wall, leaving the center of the corridor open the way people learn to do when the center of a corridor has cost them something. The taller one said her name. Not her first name, a different name, one that was not on her name tag. The fluorescent light above the nurse's station flickered once and held. Linda Brecht appeared from around the corner with a clipboard and stopped when she saw the two men. She said that visiting hours had ended at 8 and that she would need to ask them to come back in the morning. The taller man looked at Linda, then he looked back at Claire. Claire said, "Linda, I'm going to need room 7 cleared." Linda opened her mouth. Claire was already walking. Room 7 had been empty since 6 p.m. when its last patient had been transferred to the cardiac floor. It had been cleaned at 7 and restocked at 8, and since then it had been sitting with its door half open and its overhead light off, just the pale blue light of the monitoring equipment on standby casting a color onto the linoleum that was almost the same color as water at depth. Claire hit the light switch with her elbow. The room came up in amber, the secondary lighting, because she had not hit the main switch. She had hit the secondary one deliberately. She said, "Get him on the table." The taller man said there were people looking for them. Claire said, "How long?" He said, 20 minutes, maybe. She said, "Get him on the table." The man with the hand on his ribs had not spoken yet. He moved toward the bed with the careful efficiency of someone who was managing a significant amount of pain and did not intend to waste energy demonstrating it. He sat on the edge and then lay back, and his hand came away from his ribs, and in the amber light Claire could see the dressing underneath his shirt, a pressure dressing applied tightly, competently, but now showing at the edges the dark color that meant it had been doing its job for longer than a pressure dressing was designed to do its job. Claire put her bag on the tray table and opened it. Linda appeared in the doorway. Claire said, "I need you to go to the desk and tell anyone who asks that this room is occupied by a patient transferred from St. Anne's, name pending insurance verification. And I need you to not let anyone pass the nursing station until I come out." Linda said, "Claire, I do not know what is happening here, and I need you to tell me what is happening here." The man on the bed made a sound that was not loud. It was the sound of controlled pain losing a small amount of its control. Claire looked at Linda. She said, "Linda, please." 2 seconds passed, the monitor beeped twice on standby. The HVAC system hummed in the duct above the door. Linda turned and walked back toward the nurse's station. Claire put on gloves. She moved to the bed. She said to the man, "I'm going to take the dressing off." She peeled the tape at one corner and lifted and looked, and for 1/2 second her eyes changed. Not much, enough. She said, "Who put this on?" The taller man said, "He did, mostly." She said, "When?" He said, 4 hours ago. She did not react to this. She was already moving, pulling supplies from her bag with both hands, placing them on the tray in a specific order that the taller man watched with an expression that shifted slightly when he registered what order she was laying them in. He said, "Claire." She did not look up. He said, "Your name tag is crooked." She reached up and straightened it with one finger without looking down. Then she went back to work. The wound was a penetration injury, left lateral torso, between the 8th and 9th ribs, and whoever had packed it correctly, which was the only reason the man on the table was still on the table. But correctly packed 4 hours ago was not correctly packed now. The packing was saturated, and the cavity underneath it needed to be reassessed, and there was a sound to his breathing on the left side that she did not like. She said, "What's your name?" He said, "Martinez." She said, "Martinez, I need you to breathe in as deep as you can." He breathed in. She listened without a stethoscope. She listened with her ear close to his chest, her eyes closed. The taller man watched this and did not speak. She said, "You've got some fluid accumulation. Not enough to stop working, but I'm going to need to address it before it becomes enough." Martinez said, "Do you have what you need here?" She said, "Yes." He said, "You carry that in your bag." She was already opening a sterile package. She said, "I carry a lot of things in my bag." The taller man's name, she had known before he said it, was Decker. She had known Decker for a portion of her life that she had not described to anyone at Mercy General, a portion that existed before the crooked name tag and the fluorescent 3rd floor and the medication count at 11:47 p.m. She and Decker had been in places together that neither of them talked about, and that could not be found in any personnel record that a civilian administrator would be cleared to access. And the last time she had seen him had been at a debrief in a room with no windows where she had said certain things and signed certain documents, and been told that her service record would reflect a pattern of distinctions, and that she would receive a formal separation package, and that the Navy thanked her. She had said, "You're welcome." She had meant it. She had come to Mercy General because a hospital in Phoenix had a position open, and because Phoenix was 1,100 miles from the coast, and because she had decided that the life she was going to live now was a quiet life, a useful life, a life where the things she knew would protect people she could see every day in a building that did not move and did not have a threat perimeter. 3 weeks in, she was working a Saturday evening shift and counting potassium chloride vials, and the phone had rung. She cleaned the wound, she repacked it. She managed the fluid accumulation with a technique that required a steady hand and a very specific knowledge of exactly where to go and how far and at what angle, and the taller man, Decker, stood at the door watching the room number from the window and watching her in equal measure, and at one point he said quietly, "You still do it the same way." She said, "It's the right way." He said, "I know." Martinez was conscious throughout. He watched the ceiling and breathed when she told him to breathe and was still when she told him to be still. At one point he said, "You were in the Navy." She said, "Past tense." He said, "Why past tense?" She said, "Because I'm a nurse now." He looked at her. He said, "Those aren't opposite things." She did not answer that. The blood pressure cuff was on his arm, and she was watching the number when Decker said, "Claire." His voice had changed. She looked up. She read his face. She said, "How many?" He said, "At least 3, coming up from the lobby level." Someone talked. She said, "Building security or something else." He said, "Something else." She looked at Martinez. His pressure was better, not good, better, moving in the right direction for the first time in 4 hours. She looked at Decker. She said, "I need 12 more minutes." He said, "I can give you 8. She said, "Then 8. Decker went to the window. He made a call. He spoke in a low register that she could hear but not decode, a shorthand that changed based on operation and context, and she had not been part of this particular context, so she filtered it to background and focused on Martinez. The sound in his breathing had improved. The fluid was draining correctly. The wound was closed in a way that would hold through transport, and Martinez was looking at the ceiling with the expression of someone recalculating something, running new numbers against an old estimate. He said, "Why did you leave?" She said, "Martinez, I don't know you." He said, "I know, Decker told me about you on the way in." She finished tapping the dressing and pressed her fingers against it once to check the seal. She said, "What did he tell you?" Martinez said that you were the best trauma medic he'd ever seen in the field. She began stripping her gloves. She said, "Decker's been in the field a long time." Martinez said, "That's what makes it mean something." The door opened and Linda came in fast. She said, "There are men at the nurses' station who are asking for this room. They have identification." Claire said, "What kind of identification?" Linda said, "Federal." "One beats 2. Claire said, "Are they in uniform?" Linda said, "No, suits, 2 of them. There's a third one at the elevator." Decker had turned from the window. His hand was at his side. Claire said, "Decker." He looked at her. She said, "Don't." He held still. She thought for 1 second, the kind of second that contains a large number of decisions moving very fast in a compressed space. She looked at Martinez. She looked at the monitor. She looked at the dressing she had just placed. She thought about the 12 minutes she had asked for and the 8 she had been given and the 4 minutes still remaining in that window. Then she picked up her bag and walked to the door. She said to Linda, "Tell them I'll be right out," and she walked to the nurse's station. There were 2 men in suits standing at the counter. The third, she noted from her peripheral vision, was at the elevator back to the door watching the stairwell. They had taken positions that covered exits. This was not the posture of people who had come to ask questions. This was the posture of people who had come to finish something. The taller of the 2 men looked at her name tag. He said, "Claire Reyes." She said, "Can I help you?" He said, "We're looking for 2 individuals who may have entered this building in the last hour." She said, "We have visiting hours for a reason. If someone came in after 8, I would have been notified." He said, "These individuals would not have gone through the main entrance." She said, "This is a hospital. Our patients don't come through the window." The man looked at her steadily. He had the look of someone who was very good at this, the kind of good that came from many conversations that ended the way he needed them to end because he had learned exactly how much pressure to apply and exactly when. He said, "You're new here." She said, "3 weeks." He said, "Where were you before this?" She said, "Travel nursing, it's on my application." He said, "Where specifically?" She said, "Do you have a warrant?" The fluorescent light hummed, the monitor at the nurse's station beeped twice. Down the hall, one patient's call light came on. She watched it. The man said, "I don't need a warrant to have a conversation." She said, "You're right, and I don't need to continue one." She looked at the call light and said, "Excuse me," and walked toward it. She heard him behind her. He said, "Ms. Reyes." She stopped. She turned. He held up a photograph. She looked at it. She looked at the photograph the way someone looks at something they are seeing for the first time and trying to understand. She said, "I'll let you know if I see them," and she walked to the call light. The patient in room 4 was an elderly man named Walter Huang who could not sleep and who had been at Mercy General for 11 days following a hip replacement, and who had developed, over those 11 days, a habit of pressing his call button when he saw someone he recognized walk past his window. He had told Claire on her second day that she walked like his granddaughter, which she had not known what to do with, so she had sat with him for 6 minutes and listened to him talk about his granddaughter, who was a marine biologist in Hawaii. She went to his room. She sat in the chair beside his bed. She stayed for exactly 4 minutes. When she came back to the nurse's station, the 2 men were gone. The elevator was empty. The stairwell door was settling back into its frame. She went to room 7. Decker and Martinez were not there. The monitor was on standby. The tray had been cleared. The dressing packaging had been folded and placed in the biohazard bin. The pillow on the bed had been repositioned exactly as it had been before anyone lay on it. She stood in the room for a moment. The amber light made the linoleum look like shallow water. The HVAC was humming. Through the window, the Phoenix skyline was orange at its edges from the lights below, and the sky above it was the particular shade of dark blue that comes at the end of night when the darkness is not quite ready to let go but the light is already pressing at the other side. Her phone buzzed once. A message with no sender ID, 3 words. It said 12 minutes clean. She looked at the message for a moment. Then she put the phone in her pocket and walked back to the nurse's station. Linda was at the desk. She had both hands on the counter and she was looking at Claire with an expression that contained several things at once, none of which had formed into words yet. Claire sat down. She opened the medication log. She picked up her pen. Linda said quietly, "Who are you?" Claire looked up. The name tag was crooked again. She did not straighten it. She said, "I'm the night nurse on 3, and she went back to the count. Linda watched her for a moment, then she picked up her clipboard and walked away. The phone in Claire's pocket was warm from her body heat. Outside the window, the sky was pressing toward morning. Martinez was somewhere in that city, moving through it with a dressing that would hold until he reached somewhere it didn't need to anymore. Decker was somewhere else, making calls in a language she no longer spoke fluently, in a version of the world she had decided to leave. She had decided to leave it. That was still true. She wrote the last number on the count sheet. She set the pen down. She looked at the door at the end of the hall, the stairwell door still and closed. Then she picked the pen back up and moved to the next line. She had 4 hours left in her shift. And somewhere in the building's phone system, rerouted twice, there was still a record of a call that had come in at 11:47 p.m., connected for 6 seconds, answered and then set down, that no one had traced yet but that someone, eventually, would.